Okay, Vraylar, next, pretty please. As always, it's nice to see the chemical structure of a medication. Vraylar is known as cariprazine. It was approved in the United States for use in 2015 for schizophrenia and bipolar disorder, and it has also been shown to be useful in bipolar depression as well as an adjunct for major depressive disorder. Now, Vraylar is a pretty special medication, and I want to explain why with some background. You have 5 types of dopamine receptors, D1 through D5. I know, very cleverly named. D1 and D5 act similarly, D2 through D4 act similarly. The main focus of schizophrenia treatment is D2 receptor antagonism, so blocking the D2 receptor. So let's take a look at the binding profile of Vraylar. Most second-generation antipsychotics act as a antagonist against serotonin receptor 2A. Vraylar is an inverse agonist. So an antagonist, just as a reminder, competes with the molecule that binds to the receptor. An inverse agonist binds to the receptor, stabilizes it, and produces an effect opposite of what an agonist would do. So antagonist is like partial shutdown, inverse agonist is like total shutdown, and also some other effect by stabilizing the receptor. Its effects on the serotonin receptors are the reason why it's useful for mood, but the real magic is in the D2 and D3 receptors, specifically the D3. And the reason why is because where D3 receptors are concentrated in the brain. I know that doesn't seem like they're super far apart, but that is super far apart. Now this diagram looks really complicated, but I want you to look at the dorsal striatum, and where I circled the dopamine pathway from the substantia nigra, and the ventral striatum is dopamine pathway from ventral tegmental area. Because D3 receptors are located on the ventral striatum, and the activity is modulating the dopamine pathway from the VTA, and not the substantia nigra, it causes less extrapyramidal side effects. Extrapyramidal side effects are movement side effects that people tend to get from second-generation antipsychotics. And the reason why people get movement issues from second-generation antipsychotics is because dopamine also modulates movement. One other really cool thing about Vraylar is that a lot of people don't feel like overly sedated on it. In fact, people tend to feel a bit more awake. It has been shown to have pro-cognitive effects on studies in rats and subjective experiences in patients. Patients tell me they feel more perked up. There's so much more to talk about with Vraylar, but I feel like that was enough. Please let me know if you have questions about it below.